Hi, Kate.
Hi, doctor. How are you?
I'm good. Nice to meet you. So I have here that we've got you in for a head-to-toe assessment today, and that's partially because we have not seen you before. Is that correct?
That's right.
Okay. So it looks like when you called in to make the appointment, specifically it was because your eyes were bothering you?
Yeah, I'm having a little blurriness in my vision.
Blurriness? Okay. Is it in both eyes, one eye?
It seems to be in both eyes, and it's really especially when I'm reading or driving.
Okay, driving. So when you're doing active use of the eyes, is it worse at all in any time of the day?
I'd say it's worse in the morning.
Worse in the morning. And does anything make it better? You said reading and driving makes it worse. Anything make it feel better?
If I stay out of the sunlight, it seems to be a little better.
Okay. So we'll definitely take a look at that. Has this ever happened to you before?
No.
Okay. And any other issues with your vision? Any trouble with distances or nearsighted vision or any floating things in your eyes?
No.
Okay. Do you currently wear any glasses or contacts?
I wear contacts.
Do you have them in right now?
I do.
Okay. And is that prescription still effective for you?
It is.
Wonderful. So before we begin, I will pay particular attention to the eyes in this exam, but we do of course want to go head to toe to get a full medical on your chart for the next time you come in. I'm just going to move down system by system and just sort of ask if there's any issues there before we have you actually start the assessment.
Okay.
So any headaches or pain in your head?
No.
Okay. And what about any issues with your ears or your hearing? Any itchiness, anything like that? Okay. And changes in your smell?
No.
And obviously we talked about the eyes, so I just skipped over those. But anything worth note that I didn't say, any dryness or itching?
No.
Okay. Any change in your taste?
No.
Okay. Any pain in your teeth or sores?
No.
Okay. Moving down just to your joints. Have you been having any joint pain, tenderness, anything like that in any of your joints?
No.
Good. What about the chest? Any palpations? Feeling the fluttering in your heart at all?
None of that.
And the lungs? Any trouble breathing?
Nope. No trouble.
Very good. Right. How has your stomach been? Are you having regular bowel movements? Any pain, discomfort?
No pain. Everything's good.
And do you have any allergies to food?
Yes, tree nuts.
Tree nuts. Okay, so I'll have that in your chart. And you said no pain in the joint, so moving down, just any tingling in the arms, the legs, anything like that?
No.
No. Okay. All right, so it sounds like you're pretty healthy other than that little problem with the eye, which we'll take care of, take a look at. But anything else you want me to know before we get started?
Nope.
Okay. I'm just going to sanitize my hands here. Is it okay if I touch you for this exam?
Yes.
Okay. So I'm just going to palpate the head now, and just feel free to just keep your head straight. Let me know if there's any pain here.
No pain.
No pain. I'll go back here.
No pain.
Okay, I'm just feeling for any lumps, bumps. That's all okay. Take a look at the scalp now. Let's grab the light. And I'm just going to look at the scalp itself. It's really healthy. The hair is nice and thick, no thinning issues, right?
That's correct.
Okay. Just gonna check the back. Okay, that's fine. Those are all normal findings and no pain in the head, which is good. Any pain when I press here?
No.
What about right here?
No.
Okay. Just gonna feel the pulses. Just gonna look at the face. Close your eyes for me, please. Just looking at the skin. Looks really healthy and smooth. A little bit of freckling, but nothing concerning to me. Your eyebrows are nice and symmetrical. Can you lift your eyes up for me, please? And keep them up there. Don't let me close them. Okay. And puff your cheeks out for me. Okay. And smile nice and big. Very good. And can you just frown for me? Just looking for symmetry. That's perfect. So no drooping of the face. Some great facial movement there. Okay, let's take a look into the eyes themselves. So feel free to just push your hair back for me. Perfect. So I'm just going to start by looking into the eye itself, just because you're already having some of that discomfort. So you're going to see a bit of a bright light, and I am going to need you to keep your eyes open, so I do apologize for any discomfort this might cause. So just stare straight out into the distance for me, please. I'm just going to come in from the side. Okay. Blink for me. Just, I know that's a little intense. And this side. The back of the eye looks good. I'm going to have you look at this thing. Does that have any double vision there?
A little bit.
A little bit. So how's it about here?
It's coming together.
Coming together.
Mm-hmm.
Tell me when you can see it in one piece.
A little more. Yeah, I can see it there.
Okay. I want you to follow it just with your eyes. Don't move your head. I'm just going to watch the movement of your eyes. Any pain with this?
No.
Okay. Look out into the distance again. Ignore me here. And now look. And ignore. Okay. So there was a slight irregularity there. Just a little bit of mild nystagmus in the right eye especially. And the double vision did occur a little bit further out than we normally see. So that does show me that there is some abnormalities with the eye itself. Just going to look at the pupil size here. And that's appropriate for the room. Okay. I am going to shine another light in your eye now, and it's going to be bright, so I do apologize. But again, just stare straight ahead. Just try and be quick. Good. And right to the middle there, just stay out of the way. All of that is fine. Normal change of the pupils. Do a couple of vision tests. You said the contacts you have in are okay for you, right?
Right.
Now I know reading is bothering you, and I want you to tell me if that blurriness is occurring or if it's too uncomfortable for you, okay?
Okay.
All right, so can you see this about here?
I can.
Okay. Can you read this line for me, please?
FPH.
Very good. What about the one below it?
It's a little blurry, but
A little blurry? How about here?
okay. OLCF.
Okay. So that is very good, but that is about 20/40. So if it was already getting blurry, I would say perhaps your prescription is not quite up to date. Let's do a couple more tests. Hold this over one of your eyes. Just whatever one you choose. Perfect. And just look straight at my nose. Ignore my fingers, but tell me when you can see them in your peripheral wiggling into.
I can see them.
Good.
Yes. Yes. Yes.
Okay, switch eyes for me, please.
Yes. 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 Yes.
Peripheral's perfect. No problems there. You ever had any trouble with color blindness? Has anyone ever
Not to
mentioned
my
that?
knowledge.
Right. I'll show you a picture. I want you to tell me what number you see here.
73.
Very good. Let's do a couple other. What number is that?
7.
Okay.
6.
And then I'm going to give you something to trace. Just find it here. So with your finger, what I want you to do is start here on that pink one. You see that there?
Yes.
And trace it all the way around to the X to the other side. So there's no issues with color blindness, peripheral's intact, but we did sense that a couple of abnormalities in the nearsighted reading, as well as with the follow test there of my finger. What I'm unsure about is if it's simply that your prescription's a little out of date, it's causing some eye strain, which could trigger an ocular migraine. And one of the most common symptoms of ocular migraines are blurry vision. So what I don't know if it is that or if it's more of a neurological issue that's coming from the cranial nerves. So let's do a few more tests here, see if there are any other neurological signs. If there are not, I'm going to say that you probably need to go back to the optometrist for an updated prescription. Let's do a few tests here. So moving down to your nose, I'm just going to take a look first. So let me sanitize my thing here. Okay, so just tilt your head back for me, please. I'm just gonna take a quick look. Nice and clear. No drainage. Okay. No pain in the nose, you said?
None.
That feels okay.
Yes.
I'm gonna give you a couple of things to smell. And you said you're allergic to tree nuts, right?
Yes.
Okay, so let's avoid that one. So I've got 3 other scents here. I just want you to close your eyes, and I'm going to show you 2 or 3 of them, and I want you to just take a big whiff. First, closing one nostril. So close one of them, choose one, and take a big smell of that. What does that smell like to you?
Like coffee or chocolate?
Yep, coffee is exactly correct. And this one's a little bit trickier, so cover the other side there. Take a big smell of that one.
Is that ginger?
That's correct. And our last one here, I'll just do with both open. So
Is that garlic?
that's garlic, very good. So no issues with the nose. As long as I have this out, I'm just going to give you something to taste. I want you to tell me what it tastes like. So open your mouth for me. I'm just going to put that on your tongue. Okay, what does that taste like to you?
Lemon?
Yes. So both of those sensories are intact. Just make a note. And you said no change in smell or taste anyway, so.
No.
So that's good because that rules out something more in the, for the eyes, something more in the, of a cold or a sinus infection that could affect other parts of the face. Okay. Let's take a look into the mouth as long as I have this out. Can you say "ah" for me, please? Okay. And that's fine. Can you push your tongue into my hand on the inside here? Very good. And over here. And stick it out for me. And move it side to side. Good symmetry. And strength as well. Just look at the ears. Very good. Okay. Let's do a couple of little hearing tests here. Put just a little puff of air, just like that, okay? And I just want you to close your eyes and tell me left, right, which side you hear it on.
Left. Right. Right. Right.
Very good.
Left.
Okay. Do you hear this sound here?
Yes.
Okay, close your eyes, tell me when it stops.
It stopped.
Okay,
Stopped.
very good. I'm going to hit this tuning fork. It's going to make a little bit of a sound and put it in the middle here. I want you to tell me which side you hear it on or if it's equal.
It's equal.
Perfect. Putting it behind here. Do you hear that?
Yes.
Tell me when it goes away.
It stopped.
You still hear that there?
Yes.
Much louder, right?
Yeah.
That's good. That's how it should be. Same thing here. Tell me when this stops.
It stopped.
Still hear it.
I hear it.
Okay. So hearing's intact. I don't think we need to do further testing there. I'm actually going to test the sensation of the face when you're laying down so you can be a little bit more relaxed. So I'll move on now to just taking a look at the neck. So I want to feel your neck now, specifically looking for the lymph nodes. Let me know if there's any pain with this. Shrug your shoulders for me. Okay, good. While you have them up, push against me. Okay. Can you swallow for me? Just want to look at the neck. Very good. I don't see any pulsations either. I'll look while you're laying down as well, but I'm just going to feel side to side the pulses here. Good, nice and strong. Okay. The last thing I want to do here is just listen to your heart and lungs on the front, and I'll have you swing around and take a listen to the back. So, you said no problems with any of that, right?
No.
So I'm just going to listen for now, so just relax. I'm going to listen a couple places. Okay, I want you to take a breath for me. Just a normal breath is fine. Just going to go underneath this arm here. And on this side. Okay. Lung sounds are clear. I'm going to do a little tapping in just a couple places. Just listening for the resonance. Okay, none of that was painful, right?
No.
Okay. You say 99 for me?
99.
And one more time down here.
99.
Good, I can't feel a thing. Okay, so no issues there. I will actually have you lay down first, and then I'll do your back at the end here. So lay back for me, please. I haven't found anything else of concern, but let's continue to investigate. All right, Kate, so continuing while you're laying flat here, I am just going to look at that neck one more time. So just turn that way slightly for me, please. Looks great. And while I have this out, I'll take a look at the arms. There's quite a bit of freckling. Are you seeing a dermatologist regularly to get those checked?
Twice a year.
Twice a year. And any issues so far?
I've only had one.
Okay. So, but as long as you're checking them regularly,
I am.
that's all that matters. Okay. I'm just going to feel for the temperature here as well. Good, nice and warm. Come around and check the other side. So you just put this here. And checking for temperature. Consistent. Alright, so let's do a little bit of sensation, starting out with the face itself. And I'm just going to be touching the face very gently with this little piece of cotton. It feels kind of like that. You feel that?
Mm-hmm.
Just say yes when you feel it, keeping the eyes closed.
Yes. 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 Yes.
Okay, and does that feel the same side to side?
Yes, it does.
Same?
Yes.
Okay. Now, a little bit of sharp and dull. I'm just checking those two sensations. You feel the difference on those?
Yes.
Okay, just say what you feel.
Sharp. Dull. Sharp.
Good.
Dull. 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 Sharp. Sharp.
Okay, all facial sensations intact. What temperature does that feel like to you?
Cold.
What about that one?
Warm.
Good. Do you feel this buzzing here?
Yes.
What about now?
No.
Okay. Do all that again. I'm just going to make my way down your arms.
Okay.
So again, just say yes when you feel it.
Yes. 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 Yes.
Can you flip your arm for me?
Yes. Yes.
Okay, very good. Do the same thing on this side. Just bring your arm up for me, please, so I can grab it. And tell me where you feel this.
Yes. 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 Yes.
Flip the arm.
Yes. Yes.
Okay, relax. Same thing, sharp or dull.
Sharp. Dull. Dull. Sharp. Sharp.
Okay, on this side.
Dull. Sharp. Dull.
Okay. What does that feel like?
Cold. Warm. Warm.
Put your other arm on your stomach for me, please.
Cold. Warm. Cold.
Okay. What do you feel right there?
It's vibrating.
What about now?
It's vibrating. It's just touching me.
Okay. I've got a very sharp tool here. I'm just going to run it very lightly down your arm. And I just want you to tell me if the sensation changes at all, if it gets less or more sharp at all down the arm. How does that feel?
The same.
Good. Same thing on this side.
The same.
Okay. All right, so all that looks fine. I want to test a little bit of strength in the arms now, so I'm going to have you push up against me. Good. Can you go like this and push me away here and pull me? Okay, and can you push up on this side as well with just this arm? Flatten it out like that. Yes, and push up. There you go. And push forward with your head here and turn to the side and to the side. Any pain in the neck with that? There?
No.
Okay. Take a listen to your stomach now. Same thing, a little bit of tapping. Any pain with that?
No pain.
I'm just going to feel a little deeper now. No pain with that.
None.
Okay. So that all sounds fine. I'm just going to feel for the kidneys right in the back here. Okay. What's your diet like generally?
Well, I'm a vegetarian, so
Okay.
I eat lots of fruits and vegetables, but I also do eat a lot of cheese.
Cheese is delicious. Sounds like you're balancing that out with fruit and vegetables. Protein-wise, are you getting enough? I know you can't eat tree nuts, but Other sorts
Eggs.
of eggs. Okay, so not vegan, just vegetarian. Eggs are great. Other types of beans are great.
Yes.
Lentils, things like that. I'm sure you know as a vegetarian. So I'm going to just move down to your legs now and do a little bit of that sensation right at the bottom as well as the strength. So while I'm here, you can just pull your leg, this leg back up to your chest, good, and keep it there. And push me down here with the whole leg. Good. Same thing on the other side, come back and pull me down. Any pain in the hips with that?
None.
All right, I'm going to come around to the other side and just perform a little bit of sensation. So start out by just taking a look, again, feeling the temperature of the skin, checking for any swelling, edema. Feels great. Can you put the feet up like that? Yeah, back like that, perfect. And forward. Any pain there in the joints? Okay, just relax for me. Do you mind if I just inch these up about a couple right there? That's perfect. And good, just like that. So again, say yes when you feel.
Yes. 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 Yes.
Good.
Yes. 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 Yes.
Okay, sharp or dull?
Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp.
Good. Which is colder, 1 or 2? Keep the eyes closed.
2.
Good.
1.
Okay. Tell me what you feel here.
Vibration. It's still. Still. Still.
Okay. What about now?
Vibration.
Okay. And the last thing, this same kind of sharp tool here, and just tell me if there's any sensation changes as I go down. All the same?
All the same. All the same.
Very good. So what I'll have you do now, Kate, is just sit up, but with your legs this way so I can look at your back, okay? So I'm just going to move your hair to the side here. I'm going to feel down the spine. Any history of scoliosis?
No.
Okay. Can you just tip your head forward as if you're going to dive into a pool and go all the way forward and then slowly come up 1 vertebrae at a time? Very good. I'm just going to feel the muscles now. Okay, I'm going to tap on the back, same as before. Any pain here?
No pain.
Okay, and listen to the back. I want you to take a breath every time you feel me touch you. One more. Good. Can you say 99 for me, please?
99. 99. 99.
Okay, and take a deep breath in and out. All right. So just swing your lot back around. That all looks fine, and we'll just do some vitals, okay? All right, so let me get your blood pressure here. So this is going to go on the inside of your left arm here. And what's going to happen is I'll start here, and you'll just go up like that and relax. Then and relax for me, please. And 108/80, which is good. And pulses 69, oxygen 98. And the temperature was normal as well. It was at 98.8. All right, so Kate, what I'm going to say is probably you need to go to the optician, get a new prescription for your eyes. I think it's just a little outdated. You're getting some ocular migraines from not being able to read without straining. But I'm not seeing any neurological issues. I'm not seeing any other issues with the head to toe. So we'll just make a note of that, and I can write you a referral.
Okay, thank you, Dr. B.
You're welcome.